It's been almost a week now since the repeal of the Affordable Care Act failed to pass in the Senate. Today, Congresswoman Rosa DeLauro out with measures that she says will improve the law instead of replace it. News 8's Kent Pierce, live in News 8 Control this midday with details on that. Kent.
Good afternoon, Keith. Congresswoman Rosa DeLauro announcing this at City Hall here in New Haven just in the last hour and a half or so. With the repeal of the Affordable Care Act, or Obamacare, failing last week, she says it's now time to set about fixing what is wrong with Obamacare. One piece of her proposal is lowering the cost of health care. Doctors, hospitals, tests, and drugs, they're twice as expensive in the U.S. as they are in other countries. DeLauro is proposing a drug price review board to help that. If a pharmaceutical company wants to jack up the price of a drug, they have to explain why and get permission from a panel, sort of like utility rates are done in Connecticut. Another idea is lowering the age at which Americans can sign up for Medicare. If you make it so people can apply at age 55, you put a lot of your highest risk customers into an existing healthcare system that most people agree works fairly well. Most of all, we need to get rid of the uncertainty about what's going to happen next. Insurance companies hate uncertainty.
We need to stabilize the marketplace, ensure that there are affordable, high-quality coverage options for every American. We need to bring down the cost of premiums and deductibles. We need to reduce the uncertainty and the unpredictability in the insurance marketplaces.
Which is tough, of course, because the main thing people don't like about Obamacare is the mandate that everybody has to purchase health insurance. If you take that away, you don't have enough young, healthy people buying insurance to pay for all the people who are sick and need care. And that's how insurance works, after all. You need more people who don't need it buying it to pay for the people who do need it. Obamacare helped poor people pay for that insurance, but if the federal government takes away those subsidies, well, the poorer people won't be able to afford coverage. And that, of course, is the biggest uncertainty of all. Millions of Americans not knowing if they will be able to afford coverage in the coming months. Live in News 8 Control, I'm Kent Pierce. Keith, back to you.